So today I'm going to show you how to use 2 of the 4x5 OxySpur with adhesive to cover a very large wound. First, we're going to pretend like we have a large wound here on the shin. So what we're going to do is we're going to bud up 2 dressings. Like this to cover the wound. But first what we're going to do is we're going to want to cut the adhesive off of one of the dressings right here. Making sure not to cut the cannula. Now we're going to place this one down first. Take the paper backing off of the hydrocolloid border. So make sure that the end of your wound is covered by the foam part of the dressing. And you don't have to have its complete seal. You can have a little bit of wrinkles in there as well, it's fine. So with the other OxySpur, we're going to just lay it right up against, butting up the foam here with the foam on this side. And this piece of the adhesive is going to attach here and hold it all in place. So what I'm going to do now is take off the paper backing. Bud up the foam dressing together. And then this piece of the border will lay right on top here to hold the dressings in place. And again, you'll have some wrinkles, and that's fine. So this is showing 2 4x5s with adhesive covering the whole leg. You can also use a non-adhesive, just the same, butt up the 2 together and put a large Tegaderm to hold it in place. Make sure that you do a little pigtail right here where the cannula comes out of the dressing, and tape it down to hold it in place so that we don't pull the cannula out of the dressing. Just like that. So you would do that on both of the dressings. And this just helps to anchor the cannula so that it doesn't pull straight out of the dressing, just like this. So now that you have 2 OxySpur dressings, what you're going to do is you're going to get the extension set, and you're going to hook them up to each of the dressing here so that the oxygen can flow through each dressing to cover the entire wound. Just like this. And we'll do that to the other side as well. Like that. So since this right here is hard plastic, we're always going to want to make sure to buffer it away from the skin so that we don't create any kind of contact and pressure contact there. So what I use is any kind of foam that you can place right here and kind of tape down, or you can use regular gauze pads. And so since the patient's head is going this way, I'm gonna kind of try to maneuver this to go up toward the patient's head. So what we would do is something like this, and then you would just put some tape on it. So that's protecting the skin from the plastic piece here. And you would do that on both sides. Just like this. Just like that. Each of these cannulas will be hooked up to a device. You're gonna want the tubing to go under the pant leg so that it's not outside the pant leg and getting caught on things as the patient is walking by. So this will go up under the pant leg, and the end of it will go out of the waistband and connect directly to the port that says O2 on the top of the device. Just like this. And the same with the other side. It connects to the port that says O2, like this.